Article 7. Children with Disabilities. This section begins with 3 comments in separate panels. Real, active education support for children with disabilities. Massively more support for parents of kids with disabilities. We're on our own with this, and support is incredibly thinly spread and hard to access. Survey respondent. Events have access for disabled, but only with caregivers. Our daughter comes with a family. Survey respondent. To stop discriminating and ensure disabled persons' rights and dignity are upheld, whether parent or child with disability. Survey respondent. Introduction. Article 7 reaffirms that disabled children have equal rights as non-disabled children. General comment. Disabled children often experience significant barriers to the full enjoyment of their rights. Ensuring the voices of disabled children are included in all decision-making processes that affect them and creating safe and supportive environments are essential to guarantee their full and effective participation in society. The Disability Committee has not issued a general comment on the theme of children. However, the Committee on the Rights of the Child has issued several general comments. End note 77. Many of these relate to the need for children to have a voice and to enjoy increasing decision-making capacity as they grow and develop. Current place of Article 7 in law and practice. In recent years, the role of children in decisions affecting them, particularly in care and protection and youth justice matters, has received extensive attention and has been the subject of major legislation reform. End note 78. A pleasing part of this was the repeal of legislation that allowed disabled children to be removed from their families and put into state care in certain instances. End note 79. The government launched the Child and Youth Wellbeing Strategy on 29 August 2019. The strategy provides a unifying framework and a way of aligning work across government agencies to support all New Zealand children and young people to have a good life. It includes an aspirational vision, 9 principles, and 6 well-being outcomes outlining what children and young people need for a good life. The strategy includes a current program of action, which sets out the policies, initiatives, programs, and plans to help achieve its vision and outcomes. The program brings together more than 75 actions and 49 supporting actions led by 20 government agencies. These actions were backed by significant funding in the 2019 budget. The government will deliver on and add to these actions over the next 1 to 5 years. There has been a recognition within the education system that children and young people with additional learning needs require better identification and, in turn, funding to meet these identified learning needs. The government's Learning Support Action Plan is one example of this proposed approach. End note 80. Committee's previous dialogue with the state on Article 7. The Disability Committee has previously said that it was concerned some children with disabilities, especially Māori disabled children, have difficulty in accessing some government services, including health and education services. The government noted in its response that there was work in progress and it would consider the Disability Committee's recommendation when updating the Disability Action Plan. End note 81. Comment on the realisation of Article 7 in New Zealand. The recognition in the Child and Youth Wellbeing Strategy of disabled children and young people is pleasing. The IMM notes that around 450 children and young people who self-identified as having a disability were consulted in its development. The IMM looks forward to the implementation of the actions that come out of the strategy and strongly encourages these actions being co-designed with disabled children and their families to the greatest extent possible. Disabled children and young people can experience disparate outcomes in areas such as education. They also generally struggle to have their voices heard. The IMM has previously noted a lack of disaggregated data to inform policy and service delivery for disabled children. For example, Oranga Tamariki, Ministry for Children, does not collect disaggregated data on disabled children entering care or protection. The Ministry of Education advised the IMM it does not collect enrolment, achievement, stand-down, suspension, expulsion or exclusion data disaggregated for disabled children and young people. Disabled children's experience may therefore still be invisible within agencies' service delivery systems. We need to be able to track the outcomes for disabled children and young people for the purposes of better service delivery. The Oranga Tamariki National Care Standards and Related Matters Regulations 2018 give specific recognition to the communication needs of disabled children in state care. The regulations also require reporting of disaggregated data on disabled children in state care to the Independent Children's Monitor. These are welcome developments. Recommendations. The IMM recommends that the government 18. Collect more comprehensive disaggregated data for disabled young people to inform effective early intervention, especially in the fields of education, care and protection, and youth justice. 19. Continue to focus on putting mechanisms in place to put the child's voice at the centre of policy development.